Well, COVID was a global pandemic that struck the world and made it a lot of things really hard, just made a mess of things. Costa Rica, of course, was in the section. For example, tourism. Costa Rica's probably main source of income was totally blown. People couldn't travel here because of COVID, and there was just this big risk of getting infected, and there was a risk of dying or just feeling bad or just having a bad time overall. So, of course, that it was hard Costa Rica's tourism. But, um, however, there was actually a positive impact in our economy, and that was entertainment. Since people were stuck at home, they couldn't do anything. The only thing they could do is, well, watch TV. I don't know, see some online streaming, play something online. Uh, all that kind of online entertainment was just skyrocketing in income for our country. Our education, Costa Rica's education, also took a big hit because of COVID or Omicron and all these kind of variants that they went around about coronavirus. Um, well, of course, education couldn't be the same during the pandemic. If you had a close relationship with someone or just be in contact in person, there was a big risk that you could get infected, and that would mean that your family was also in danger, you were in danger, you were getting ever near you in danger. So having 40, 20 students in a class uh, really close together wasn't an incredible idea for keeping COVID at bay and having everyone be safe. So it definitely took a big hit education system. However, it did make uh, a lot of time with online classes since they were from home. Um, they just made the communication with family easier for some students. Since everyone was stuck at home, of course you wouldn't see your family over there working or doing other stuff and their chores and everything. So it was easier for you to have a closer relationship, to strengthen a bond between you and your family, and that's the case for a lot of students in this pandemic.
When it comes to our country's social security system, we speak about health related issues. By this, we mean that back then, at the beginning of the pandemic, we weren't sure, and medics weren't sure what was going on with COVID, which was very hard for everyone. We didn't have vaccines, everything was just a mess. And the government had to make some mandates about it. Mostly things like masks and social distancing, quarantine. You had to get tested to see if you had COVID or not. And we even had the car curfews and the establishment curfews, which they were a bit inconvenient, but all in all, they held a positive impact on everyone's health. People were taking care of themselves, which meant that everyone was healthy and there weren't like a lot of peaks of increase in COVID cases. But contrastingly, we know that there were people who did not actually follow these guidelines, and people started to get sick after a while of these things. People broke curfew a lot, often getting tickets for it. And there were some who just did not wear masks. They didn't like them, thought they were comfortable, weren't really worried about anything. And, you know, it wasn't very positive. So those are kind of like some of the most negative impacts these sort of health related issues had. Finally, we know that the COVID pandemic had a huge impact on the entire world, whether it be health wise, social wise, economic wise, or even education wise. It was very hard on everyone, and there were a lot of positive things and a lot of negative things. We know people got sick of everything really easily. They were tired of not being able to see their friends, and a lot of people even lost their homes or their jobs, which was very bad for everyone. But on the bright side of things, we have like the positive. We have that people were able to learn from this experience and they learned how to take care of themselves and how to be more conscious health wise. so as to not get their family sick or anything. And all in all, people did learn a lot from this. And it might have been very hard, and it probably hit a lot of families very hard. But most of them managed to get back up. And that's what's important, that we know that we can overcome these sort of situations as a society and all.